The cholesterol-causing atherosclerotic heart disease hypothesis has been falsified by modern imaging techniques, primarily the calcium score. Modern technology has advanced, and now we have a better way to measure risk for heart disease, which is the calcium score. And in the last 10 years, the serial calcium score, which is your percent change after a year, you get a second calcium score, and if your score is increasing by more than 15%, then that's a adverse prognostic indicator with high risk for heart attack. If your calcium score is increasing less than 15%, then your prognosis is good, and those people do much better. So the calcium score has emerged as a replacement for the cholesterol panel. The cholesterol panel has sort of been relegated to the dustbin of history, although mainstream cardiology hasn't caught up to that fact. And the calcium score is the new game in town. So we're going to talk about that. And our particular protocol for preventing and reversing coronary artery disease is basically the same protocol for preventing and reversing coronary calcification. And so the things that have been studied, we'll talk about that at the meeting. For example, aged garlic has been studied. Numerous studies showing that aged garlic is quite effective in slowing down progression of calcium score, much more effective than a statin drug, which statin drugs are quite disappointing for calcium score. And then there are other things in our protocol, such as vitamin C, tocotrienol, vitamin E, interventions that treat and address leaky gut, things like berberine, which is a botanical which closes the tight junctions. And then there are things that can heal the gut, and removing things like wheat from the diet, which causes leaky gut. And in the diabetic population, the most important thing is controlling the blood sugar with diet and exercise to reduce blood sugar and A1C. So that's the most significant thing in the diabetic population. And we also talked about hormonal approach to cardiovascular disease last year. We'll talk about it again this year. And so things that help deal with low-level endotoxemias, things that improve the immune system, are going to be helpful in preventing heart disease. For example, thyroid function. People with low thyroid function have an immune system that's not functioning well. We need good thyroid function for a good immune system. So they're at higher risk for heart disease because they just can't handle the low-level endotoxemia. They can't clear the bacteria from the bloodstream, and it ends up seeding the coronary arteries. So there are studies showing that people with higher thyroid function, better free T3, for example, in the bloodstream, have less coronary calcification than people, the lower 3T3 level, which is lower thyroid function, has more coronary calcification. That's an interesting study. And then, the other hormone that we talk about is testosterone in males. Diabetics and obese males, many of whom are diabetic, typically will have low testosterone, and that's because of leaky gut. The leaky gut not only affects the coronary arteries, but you have all these inflammatory molecules end up causing inflammation in the brain, which then affects the hypothalamus. They get hypothalamic pituitary axis dysfunction, and they end up with low testosterone because of HPA dysfunction. So when diabetic males are given testosterone, there's a dramatic reduction in mortality from heart disease in numerous studies, and so there's a tremendous benefit there, and we'll talk about that. And the long-term testosterone studies in males show reduction in A1C, reduction in blood sugar, reduction in blood pressure, reduction in weight, reduction in waist circumference over time. It can take years, but all these metabolic syndrome parameters get better, and that's the main reason why it's beneficial in heart disease. Is it reverses metabolic syndrome, and the diabetics get better. Their blood sugars and A1Cs get better. The main thing that's is surprising to most of the practitioners is that we now have evidence that atherosclerotic plaque is infected biofilm, and that's the reason why the arteries calcify, and the calcification is now the best way to monitor the disease process and monitor response to treatment, and so the best test for that is the calcium score, which is a CAT scan, which gives us the calcium score. So, that's the new game in town, basically. For the practitioner, the solo doctor in his office practicing clinical medicine, it means that we now have the tools to monitor cardiovascular disease accurately and to monitor treatment using the calcium score. And with the protocols that we have available now, we can now successfully prevent and reverse cardiovascular disease. So it gives the tools to the practitioner to be very successful at reducing the risk of cardiovascular disease in his patient population. And at the same time, it means for mainstream cardiology, for interventional cardiology, procedure-based cardiology, it means procedures like stenting and cardiac bypass operations are going to be reduced dramatically in scale, because the overall incidence of cardiovascular disease will decrease with the proper use of the new tools. And procedure-based cardiology will no longer be a large volume operation as it is now. They just won't have the same numbers of cases because heart disease can be prevented. Number one, the old dogma that cholesterol causes cardiovascular disease has been falsified by the modern imaging techniques. Number two, the cholesterol panel has been replaced with the calcium score, which is a new technology using a CAT scanner to measure calcification in the coronary artery. Number three, calcification in the body is most commonly caused by chronic infection, which any place in the body. This is also true in the arteries. And number four, progression of calcium score has emerged as the single most useful indicator of failure or success of treatment. If progression is greater than 15% per year, the treatment has failed and the patient is at risk for heart attack. If the progression in calcium score is less than 15% per year, then treatment is successful and patients at low risk for heart attack. So the calcium score is the new game in town. It has replaced the cholesterol panel in routine management of cardiovascular disease.